The next thing I want to do is start to examine some of the neck and shoulders. So you know what, let's have you, if you can lower your gown in front here. Okay. First of all, can you touch your chin to your chest? Good. Then go straight back. Good. Then touch your chin to your shoulder. Good. Then your chin the other way. Good. And next I want you to kind of tilt your head towards one shoulder and then the other side. Good. Okay. And just want to examine different parts of your shoulder here too. Good. Okay. You can take your arms and just go straight out and over your head. Okay. Now put your hands behind your head. Good. Then I want you to kind of touch back behind your. I just want to see how far up you can get your thumbs. Good. Okay, that's normal. You can go ahead and put your arms back in your gown. Now I'm going to go back up to the eyes. I want to do a little bit more complete examination of the eyes by looking at the fundus or the back of the eyes. What I want to do is I'm going to turn off one of the lights in the room to darken the room just a little bit. I'm going to have you stare straight across at the wall there. I'm going to come rather close to your eyes, and when I do that, I'm going to ask you to try not to look at the light or look at me. Just try to ignore me. Okay? Right. Good. Okay, I'm going to do the same thing in the other eye. Just come over to the other side here. Again, just stare straight across at the wall. Good. And those blood vessels in the back of the eye all look normal. Next thing I want to do is to look at your ears. So first I'm just going to look at the top of the ears here. Okay, now I'm going to look inside the ear at the eardrum. Okay, and that looks completely normal. There's no wax or any sign of infection. The same thing here. I'm going to look at, just pull your ear back and take a good look at that. Good. Both your eardrums look completely normal. And the next thing I want to do is to look at your nose. I'll try not to touch the middle or the septum of the nose. That's real sensitive. But just kind of look straight across the room. Okay. And the same thing here. Good. That all looks normal. The next step I want to do is to look into your mouth. I'm going to use a tongue blade for that. So can you open your mouth? I'm going to look at your gums and your teeth. That looks fine. You touch your tongue to this side. Good. Now the other side. Good. Now curl your tongue up. Touch the roof of your mouth. And put your head down just a bit. Good. Okay, now stick your tongue out. Say, ah. Good. And that all looks normal. Next thing I want to do is to examine for various lymph nodes and salivary glands in the head and neck. And I'm going to stand behind you to examine those areas. Okay, so just kind of keep your head straight. Checking the parotid glands. Can you punch your shoulders up just a little bit? Okay. I'm just going to under your chin here. Good. I'm just going to feel for the glands in the very back of the head here too. Good. And there doesn't seem to be any swollen glands at all. Next thing I want to do is just feel for your windpipe or your trachea, that it's in the middle here. And it is, and it moves freely. Good. Next up I want to do is to feel for your thyroid gland. And that's a little butterfly-shaped gland that sits in the bottom of the neck. And to help me examine that, I'm going to ask you to take a sip of water and hold it in your mouth. And when I tell you to, once I get my fingers in position, I'll have you swallow for me. Can you go ahead and swallow? Good. Can you take one more sip? I'm going to move my hands a little bit different position. Go ahead and swallow again. Good. Okay, that all feels normal. The thyroid does not feel enlarged or doesn't appear to be any nodules on it at all. The next thing I'm going to do is to go ahead and start to look at your back and your lungs. First, I'm just going to take a good look. Your spine seems to be nice and straight. There's no curvature to it. I'm going to sort of just pound on your spine with my fist. Does this hurt at all?
No.
No discomfort?
No.
Okay, I'm also going to pound a little off to the sides. Does that hurt there?
No.
How about here? Is that sore?
No.
Good. Okay. The other thing I want to do is to just watch you take a couple breaths in and out. So, and another one. Good, and everything seems to move symmetrically. I'm just going to put my hands around the bottom of your chest here now. Just breathe in and out again. Just breathe normally. Again. Good, and there seems to be a nice, normal, symmetric movement of both sides of the chest. What I want to do now is I'm going to put my hands on the back of your chest, and every time I move them, I'm going to ask you to say the word 99 for me. Okay?
99, 99, 99, 99.
Good, and that's all normal. If I could have you now grab your each shoulder like that. That kind of moves your scapula off to the side. You can actually let your arms rest, but just that how it kind of moves your scapula off to the side. I'm going to percuss on your lungs here, so you can do some tapping. Whoops. You know, actually, can we pull this down in front here, too? Mm-hmm. Okay. Make it a little bit easier. Good. I'm just going to percuss in front. You can put your arms at your sides. Good. Great. Okay. Now I'm going to listen to your lungs with my stethoscopes. I'm going to have you grab your shoulders. Just breathe in and out through your mouth for me. I'm going to come around, listen in front. You can relax your arms. Good. And your lungs sound completely normal.